Hello, everybody, and welcome to this professional unit virtual events presented by IFLA. This is an IFLA Special Interest Group Evidence for Global and Disaster Health webinar. And my name is Maria Cotera, and I'm the program lead for the IFLA Evidence for Global and Disaster Health SIG, and I will be your host for the next 55 minutes or so. We have received over 500 registrations and we have a lot of people already joining us. We are very excited by this event. The title of the main presentation is Evidence-Based Librarianship, Building the Base as we Respond to the COVID-19 pandemic and infodemic. And we have 3 people with us that come from the US and Canada joining us for this event. Before we do that and before we introduce them, I will also have to show you the agenda for the day. We're going to start with a participants poll and we'll show the poll results. Then there will be an introduction from the convener of the IFLA Evidence for Global and Disaster Health Special Interest Group, Bryce. And that will serve as an introduction to the evidence-based librarianship presentation. We will finish with the Q&A, as I said earlier. Okay, so before anything else, I'm going to launch the poll and I'm going to ask you to please follow the poll and vote as I give you the questions and the answers. So the first question is, which IFLA region are you joining us from? Pretty easy. These are the 6 regions, on the new IFLA structure: Asia, Oceania, Europe, Latin America and the Caribbean, Middle East and North Africa, North America, or Sub-Saharan Africa. Okay, people are voting. Some people are already voting on question 2. Going ahead. Are you familiar with the Librarian Reserve Corps? And there is a few answers to choose from. I never heard of it before. I heard of it, but I don't know much about it. I follow its activities. I volunteer with the Librarian Reserve Corps, or I work within a partner organization. Okay, only 40% of the people have already voted. Let's move on slowly to question 3, which is very simple, just 3 answers, and it relates to the pandemic. How has COVID impacted your workload and duties? Increase my workload and duties, decrease, or not change to my workload and duties? Have you been involved in the COVID response in a professional capacity? Yes, I have used my professional skills and expertise to respond to COVID, or no, I have not. That's a very simple yes or no question. And the last one is, are you familiar with IFLA, Evidence for Global and Disaster Health Special Interest Group? I've never heard of it before. I heard of it, but I don't know very much about it. I follow its activities. I volunteer in the Evidence for Global and Disaster Health Special Interest Group Committee, or I would be interested in finding out more about joining the Evidence for Global and Disaster Health Special Interest Group Committee. Let's give it another 10 seconds or so. 75% of you have already voted. And I'm going to end the poll very shortly so we can review the results. And in the meantime, again, I will ask Emma to post the link. So if you are interested in finding out more about joining the Evidence for Global and Disaster Health Special Interest Group Committee, you can look on the web pages, and also we can provide you with the email address so you can send us an email, and we will be very happy to talk to you and to welcome you. Okay, 89% of people have voted. I'm going to close the polling in the next 3 seconds. And it's done. So let's share the results. So 21%, no, sorry, 20 people, 10% are from Asia and Oceania. You're welcome. 37% from Europe, 10% from Latin America and the Caribbean, only 2 people from the Middle East and North Africa, and 36% from North America, including our panelists for today, and 6%, 13 people from Sub-Saharan Africa. We're very happy to welcome you all. Are you familiar with the Librarian Reserve Corps? More than half of you never heard of it before. And that's great because you're going to find out a lot today. There is 3% that volunteer, so 6 people here volunteer, and 9 people work within a partner organization. So we welcome you especially, and we thank you for everything that you are doing. We look forward to hearing more about it. How has COVID impacted your workload and duties? 69% of you says that COVID has increased your workload and duties. Oh dear. And 23% says no change. And only 9% says it has decreased the workload and duties. Okay. Have you been involved in the COVID response in a professional capacity? 74 said yes, and 26 says no. And the answers to the last question, are you familiar with IFLA evidence for global and disaster health? 45%, I've never heard of it before. And 38%, I heard of it, but don't know very much about it. So most people don't really know very much. So, okay, that will be a really good opportunity now as well to also learn a little bit more about the group. So this is what we're going to do next. And it gives me great pleasure to introduce Anne Bryce. Anne is the convener of the Evidence for Global and Disaster Health Special Interest Group, and she is also the head of knowledge management for Public Health England in the United Kingdom. Over to you, Anne.
Thank you, Maria. Lovely. Thank you very much, Maria, and welcome everybody to the session. And it's great to have people from across the world joining us today. So just a few minutes just to give you a bit of background to the special interest group and the rationale for the work that we've been trying to carry out. And we'll all be familiar with the concepts in this first quote. And we're also all familiar with the fact that when disaster does strike, it's always the poorest and most vulnerable people that suffer most, and particularly women and children. So as well as protecting people from disasters, there's a strong drive to improve equity in terms of people's access to healthcare, to the best information, and to decent lives. There's also an understanding that we need resources and money to tackle disasters, but it's less often thought about what we actually need in terms of knowledge. Next slide, please, Maria. So in 2017, I was approached in a corridor in our office, and I must stress that we're Public Health England, so it's not the UK, just Public Health England. And I was approached by one of our global consultants in disaster risk reduction, and I was asked, what were librarians doing to support the Sendai framework? And the Sendai framework is one of 3 landmark agreements produced by the United Nations. And we all tend to be familiar with the Sustainable Development Goals and the Climate Change Agreement. But I have to admit that at that time, I didn't know anything about the Sendai framework. And what's different about the Sendai framework in some ways is that it places a large onus on the need to use knowledge, to capitalize on and consolidate what's already known, but also to develop methodologies and assets to deal with, to help prepare, plan for, and build back better after disasters. So next slide, please, Maria. So let's just think a little bit about what the United Nations determine as a hazard. We're all very familiar with natural hazards. Another hazard, technological hazards. These are becoming increasingly common. We're all familiar with disease outbreaks. Certainly we're living through a global pandemic for one of those at the moment. Environmental hazards. We see these on our screens all the time. Climatic hazards, and there's a real importance of looking at how the Sendai framework supports the work of the climate change agreement. Humanitarian hazards which result from a lot of these issues are clearly very prevalent across the world. Then there's conflict hazards, geopolitical and conflict hazards, and also in the next slide you'll see something around violence and terrorism. These are also classified as disasters for the United Nations. Space, weather, and meteors, externality, things that might come to us from another plane. These are also things that are increasingly problematic and can cause disasters. What might be less familiar for people is thinking of trade disputes as a hazards or financial hazards, but these can also, all of these things can impact on the health and well-being of populations and citizens. Okay, and cyber hazards. And we've seen some instances in the last couple of weeks about how cyber hazards can actually contribute to fears around public health and safety. So this is a complicated and very wide-ranging field of work. Okay, next slide. One of the things that they're also looking at is, are there other hazards? And one of the things that we've been able to do through the group is get more involved in some of the processes that the United Nations and others are working on to tackle and implement the Sendai framework. So there are a lot of other documents and processes, initiatives that we've been helping with, things like how do you define hazards? How do you define hazards so that countries can report about how well they're doing around their hazard and their disaster risk management? So for me, the question is, how many librarians are actively involved in the planning, the production, the implementation, the monitoring of things like the Sendai framework? How critical a role should we have? So we thought we would set up a group, and IFLA seemed definitely the best place to set that up. Next slide, please. So we set the group up in 2018 with three main aims. One, to work very much on advocacy, to try and raise awareness around the potential roles that librarians have in global and disaster health. And that may be things which are produced by the sort of health sector, but it can also be things like public libraries providing places of safety, people doing geo-mapping. There are all sorts of ways in which all librarians across all sectors can support global and disaster health. We wanted to do some work on training and mentoring, how we helped spread skills and work with people to share skills better across the globe and across the IFLA community. And we very much wanted to make sure that we mapped existing activity and resources so that we really didn't want to duplicate anything that was going on. So a large part of our work has been involved in trying to work with other networks and groups to pool our expertise and to share things. Healthcare information for all. I see Neil Pakenham-Walsh is on the call, a key target for us, evidence aid, many organizations that we want to work with. Next slide. And you just think, well, why librarians? Well, librarians are critical to healthcare, public health, and the health of our communities. They work in every sector. They understand robust methods. They have professional values and standards, which are ethical. And they're very, very much part of their communities and user-focused on their communities and very good at working with others on this. So I think for me, bringing people together has been the most important part of this group. And what I think we realize now is that a pandemic such as we're in now requires global collaboration. And it also requires rapid response. And it's an example of that, but in the library community that we're going to hear about today. So thank you all very much for coming, and I'll leave Maria to introduce you to our speakers. Thank you.
Thank you, Anne. That was great. And I hope that all of you that didn't know very much about what the Evidence for Global and Disaster Health Special Interest Group is or does understands this a little bit more. And I have to thank you, Anne, for your leadership and steering the group so magnificently. Okay, we're moving on now to the main part, and I am going to introduce Sarah Lurie Nest. Sarah is the medical library manager at St. Luke's Health System in Idaho in the US. And she's also the co-director of the Librarian Reserve Corps, as well as being a committee member of the Evidence for Global and Disaster Health Special Interest Group too. Over to you, Sarah.
Thank you so much, Maria, and thank you to IFLA and the Evidence for Global and Disaster Health Special Interest Group for the opportunity to speak about the Librarian Reserve Corps. And thank you to everyone who's joined the call for attending. Next slide, please. Presenting with me today, we have Robin Butcher. Robin is a research information specialist at the Canadian Agency for Drugs and Technologies in Health, and is also the project lead for our COVID-19 literature database validation study. Next slide. And Stacy Brody. Stacy serves as the co-director of the Librarian Reserve Corps and currently leads our initiative to develop best practices for literature searching during public health emergencies. She's also a reference and instruction librarian at Himmelfarb Health Sciences Library at George Washington University here in the US. Next slide. Today, I'll start by sharing a little bit about the Librarian Reserve Corps to provide context for the talk, and then we'll move to our current projects focused on supporting librarians and information professionals in their response to COVID-19. Robin will share the methods and preliminary results of our database validation study, and Stacy will be discussing our progress towards the recommendation statements. We'll also have time at the end for a question and answer period. Next slide. Based on the poll, many of you may be asking, what is the Librarian Reserve Corps? The LRC is a volunteer network of over 140 medical and public health librarians from 14 countries, formed in March 2020, just 15 months ago, in response to a call from the research lead of the WHO's Global Outbreak Alert and Response Network, or GORN. Our partners include the WHO Library, Cochrane, the US CDC, and others. During the very early stages of the pandemic, the LRC was formed to provide what I think of as traditional library services for members of the GORN research team. Our first project was to index the WHO daily publication list for the head of GORN research, Dr. Lena Moses. When Dr. Moses initially accepted her post in January 2020, there were roughly 8 articles a day on COVID topics. By the spring, that number had rapidly grown to over 400 articles daily of varying quality. Volunteers organized the list so that she could distribute the most impactful evidence to the operational pillars. In addition to indexing, we also had work groups responding to literature search requests from the GORN research team, and we facilitated and continue to facilitate informal working groups of COVID literature database creators with the goal of streamlining efforts. In this early phase, we were responding to the pandemic, which we thought, like many, would last a few months. We took a rapid response approach, delivering services while at the same time building our processes and work groups with limited thought of a longer-term vision or structure. However, as we began to realize that the pandemic was going to continue for some time, and we also gained additional perspective and experience, we reevaluated our focus and how we might best contribute to the response. As I know many on the call have experienced, during the pandemic, librarians and information professionals have had to continually adapt our processes and practices to support our patrons in response to a rapidly changing biomedical information landscape. The urgency of requests from our patrons in the clinical and public health fields, combined with a transformation of publication processes, an overabundance of information of varying quality, and the proliferation of new databases and information portals introduce serious challenges and a need to assess and better understand this new information landscape to inform our search strategies and overall response. Many of us found ourselves unsure of the new databases and search tools, but also not confident that traditional databases were capturing the full spectrum of information being released, such as press releases and preprints. And in looking at methods and systematic reviews, it seemed that there was a lot of variation in the search methodologies reported. For these reasons, LRC pivoted to focus on librarian research projects to supply an evidence base to librarians in their response to COVID, to ensure as a profession we have the insight and information we need to deliver the best evidence to our patrons. As an organization, we're now embracing a project-based structure where new research opportunities are presented to a core of librarian or information professional volunteers. And this brings us to the present, a few of our current activities and projects. Next slide, please. Our thinking about the role of the LRC was informed by our experience with one of our first projects, the database working groups. At the encouragement of and in partnership with the WHO Library, in the summer of 2020, we convened working groups of specialized COVID-19 literature database creators and information scientists to discuss issues that impact the discoverability of information. The primary goal of these groups is to streamline efforts through coordination and collaboration. Initially, we had 5 working groups meeting every 2 weeks around key areas such as preprints, publisher relations, indexing and metadata, searching, and technical standards. Eventually, we reached a point where conversations between the groups began to overlap, and so we consolidated into one group, and over time, we have reduced those meetings to a quarterly frequency. On the horizon for this group is a lessons learned project to understand the response to the information emergency and what strategies were most beneficial to inform responses to future health emergencies. Next slide, please. The next 2 projects that we'll be discussing actually arose from the conversations in the database working group meetings. As I mentioned a moment ago, the pandemic brought with it an overwhelming amount of information as researchers rushed to share their findings at every stage of the research cycle. We find ourselves looking to preprint servers and new databases that have developed or rapidly evolved in response. Metadata fields that we rely on, like date published, have become complex as we try to understand how different publishers and databases are defining and using these fields. In order to better understand the information landscape, we started to talk about a database validation study based in part on an example from Cochrane to help searchers understand the pros and cons of the various databases and determine when they were appropriate to use. And with this, I will turn the presentation over to Robin Butcher, who's leading this work. Thank you, Robin.
Thank you for having me. I'm pleased to be here today. And this is the first time we are sharing our results, so we are very interested in your feedback. And the title of our study is The Currency and Completeness of Specialized Databases of COVID-19 Publications. Next slide, please. And this is a list of our authors, as well as Sarah and Stacy. There's Rachel Kubin, who is at McMaster University, James Mallon, who is at NYU, and Margaret Sampson, who is based in Ottawa. She is with the Librarian Reserve Corps, as well as CHIO Research Institute. Next slide, please. So Sarah has already given a bit of background on the genesis of the study. We were looking to do a third-party independent evaluations of these collections. I came aboard a little bit later after pilot study had already been done, and the pilot study looked at currency using slightly different methods than the ones I will be eventually describing. The study evolved to also include looking at the completeness of these collections in order to determine whether these collections could be used as a source for systematic review. So the collections that we focused on are Epistemonico's COVID-19 Love, WHO COVID-19 Global Literature Database, Lit COVID, Comrades COVID-19 Souls, Cochrane COVID-19 Study Register, and then we also used PubMed as a comparator. And there were some other collections that we considered. There were a couple of living systematic reviews, but they weren't searchable. You either had to browse or do Control F. And ultimately, the one criteria we had for the COVID-19 collections that we selected was they had to have at least a basic search function. And the other thing to keep in mind is that we started this study around springtime 2020. So the collections had to be established by then. We didn't look to see if there are any other collections that have been created since that time. I'm not aware of any other ones, but I would be curious to hear if anybody else is using any other COVID-19 databases. Next slide, please. And our main objectives were to evaluate the completeness of the specialized collections of COVID-19 research and to measure the currency. So the time from when COVID-19 articles are published to when they were entered into the specialized collections. Essentially, we wanted to see, do they have everything and how fast do they get it? We did this as one study, but it was done in two distinct stages, completeness and currency. The methods are different for each, and we have separate protocols for both the completeness and currency. Next slide, please. So the systematic reviews were selected from the Epistemonico's COVID-19 collection. We wanted a mix of different types of systematic reviews, so we cycled through the 5 categories that Epistemonico has. So prevention/treatment, diagnosis, etiology, epidemiology, and prognosis. Once an eligible review was identified from one category, their included studies were added to our list. And then a review was selected from the next category, and their included studies were added onto the list. And this continued until we had 500 primary studies identified. And I wanted to note that we did include preprints if that was what was cited. There was duplication of included studies among the reviews. So ultimately we ended up with 440 unique primary studies. For a systematic review to be considered eligible, they had to have searched at least 4 sources and have some sort of search statement described. And we divided the studies among 10 volunteers selected from the Librarian Reserve Corps to test each of the COVID-19 collections to see how many of the studies were present in each collection. And I don't want to go too deep into the details of our methods, but our protocol is available on Open Science if you do want to see the full methods. And next slide, please. So here's our table for completeness that looks at the inclusion rate of studies in each COVID-19 collection. And the first thing I do want to note is that our results are still preliminary. We are still working on some data validation. And you can see for all the collections, the records found are pretty high. It ranges from 83.4% to 93.2%. And you will notice a number of records in scope are different for Cochrane compared to everyone else. And that is because Cochrane has a slightly narrower inclusion criteria for their database. Okay, next slide, please. And this table looks at unique contribution relative to other collections. It's a little bit tricky to explain, but it's looking at studies found in the collections that were not found in the other collections. So for example, if we look at the first column, there were 27 studies found in Epistemonico's that were not in WHO, 32 studies that were in Epistemonico's that were not in COVID and so forth. So the point of this is to show that there are unique records in each one. So there is value in searching more than one of the collections. However, no combination is going to get all the records. I believe that there were 4 records that were not found in any of the collections at the time we did the searching. Next slide, please. And then for currency, we tracked 50 journals selected from Web of Science that had published 16 articles or more on COVID-19. And once we had the list of journals, our team of volunteers, again drawn from the Librarian Reserve Corps, monitored the journal websites until a new relevant article appeared. And our observation period was 30 days. So if an article wasn't published on the journal site at the time, the journal was marked as nothing found. If a relevant article was found, then our volunteers stopped checking the journal website because we really only needed 1 article per journal. And then they started checking daily to see for the article's appearance in each of these collections. If it had not appeared in the collection by 2 weeks, we declared it not current for that article. And again, our protocol is available on Open Science if you want more details. And here's our criteria for article eligibility. I won't read out all of it, but it did have to be a primary study. It had to be about COVID-19, and it did have to present results. And it could be a preprint if that was what was on the journal website. Next slide, please. So currency, we define that as being present in the database within 2 weeks of appearance at the journal website. And you will notice that Cochrane is grayed out, and that is just because we do need to verify that the articles that were marked as not current are actually in scope for Cochrane. And here we have the number of articles found per collection with the percentages, and it ranges from 60 to 78%. We also have the numbers of what is present on day 1, day 7, and day 14. You can see there's a large increase between day 1 and day 7 for all of them. And again, these results are still preliminary and they are subject to change. Next slide, please. So for completeness, all the collections studied here contained more than 80% of the publications of interest. And then for currency, all the databases contain 60% of target articles within 2 weeks of their appearance. And WHO and LitCovid were comparable to PubMed with high currency. What the study shows is that these special collections could replace paywall databases that are often used in systematic reviews. All sources studied here are open access, while 4 of the 5 databases searched most often in our sample of web systematic reviews are available only through subscription. And one thing I think that was mentioned earlier was that these collections were not being used in systematic reviews. And we did find that that was true when we looked at the sources in the systematic reviews that were chosen for the study. However, these collections are still fairly new, and the time between when the collections were created and when systematic reviews on COVID-19 started being published was very short, a few months at the most. It would be interesting to see, now that these COVID-19 collections have been around for over a year, whether new systematic reviews are using them for sources. That's not something we're necessarily planning to look at yet, but it might be a good follow-up. So I am looking forward to hearing any questions you may have in a little bit, but for now I am going to pass it back to Stacy.
Great. Thank you so much, Robin. It was really exciting to hear those preliminary results. And it seems like this is definitely a topic of interest based on the chat. So look forward to some of those questions and answers in a bit. Again, my name is Stacy Brody. I'm co-director of the Librarian Reserve Corps, and I'm going to be talking about a second project that arose from the database working group conversations. And this one is the best practices statement for searching during public health emergencies. So thinking back to the poll earlier in this session, it looked like about 3/4 of us were responding in our professional capacities to COVID-19. And some of us may have encountered challenges that Sarah explained earlier in the presentation, or we're encountering these new databases. So the aim of this second project is to develop a guidance document of best practices for searching during public health emergencies. Next slide, please. So we started by bringing in a core group of experts. From our database working groups, participation in other evidence synthesis groups, and nomination by professional colleagues, we recruited 12 experts to discuss. Technical difficulties. I see in the chat the sound is low. My other panelists, how is the sound quality?
That sounds better, Stacy.
Okay, thank you. So I'll pick up where I left off, and I'm happy to readdress anything in the Q&A later for the sake of time. So we started this best practices for searching during public health emergencies project by bringing in search experts. So these are librarians, searchers, evidence synthesis, information science researchers, and database creators from our database working groups, evidence synthesis groups, and nomination by professional colleagues. We have representation from the Americas, Europe, and Asia, and Oceania. Next slide, please. So we started by surveying these experts to determine the core elements or core aspects of searching that we should address in this best practices statement. Based on the survey responses, we were able to identify 6 topic areas that this guidance document should address. The first one is core resources. So kind of echoing the conversation from the database validation study, when we're searching during public health emergencies and might be encountering emergency specific collections or new and emerging databases, how do we determine which resources to use, especially since they might not be the ones we traditionally use for our systematic reviews and evidence synthesis work? We then identify the element of search strategies, so how to evaluate and determine when to reuse search strategies and how to report them. We wanted to talk also about publication types. We saw kind of the skyrocketing of preprints during this emergency, and we don't think that's going away. So how to incorporate and identify publications that aren't traditionally peer-reviewed articles and incorporate them in reviews and searches. We're moving on to transparency and reproducibility. So how do we report our search protocols in a way that's transparent and aligns as best we can with existing guidance on reproducibility reporting. We also want to talk about collaboration and communication. So how to work together across communities of practice and internationally during emergencies. And how can we conduct research to support the information response during public health emergencies? So we ourselves as information professionals have evidence to support our own work. Next slide, please. With these elements in place, we developed guiding questions. So we looked back at conversations that we had in our database working groups. We reflected on our experience searching in response to COVID-19. And we looked at the literature on searching during public health emergencies. And with that, we created guiding questions and sent those off to our experts, our expert participants requesting written feedback. We provided a timeline or anticipated timeline of the project, description of the scope and objectives, as well as other documentation to kick the project off. Next slide, please. We asked our experts to submit written responses to those initial guiding questions so we could review those and synthesize responses. From those responses, we were able to identify areas of agreement as well as areas of discussion and potential disagreement. And we used that to identify and develop facilitation questions and have guided discussions. So that's where we are now. We have one meeting left to address our last topic area, and we're starting to see themes emerge. Next slide, please. We'll take the next month or next several months to flesh out those themes and write out our guidance document, as well as an accompanying white paper that goes into more detail about the recommendations as well as their methods for development. We'll use the meeting transcripts as well as those initial responses to the written guiding questions and evidence from the literature to inform the statement and accompanying white paper. We'll have external reviewers go through and provide comment and fill in any knowledge and expertise gaps. And then we'll disseminate the statement via presentations, preprints, and publications, and hopefully post the white paper on our website. Next slide, please. So throughout this project, throughout this pandemic, and with the evolution of the Librarian Reserve Corps, we definitely learned a lot. Next slide, please. As Anne mentioned in her opening, one of the key things we need in response to public health emergencies and disasters is knowledge. And one of the things that I've been reflecting on and that has been impressed upon me is the importance of evidence-based librarianship. So as medical and health sciences librarians, we often serve our communities. To provide evidence for evidence-based medicine and evidence-based practice. We as librarians can practice evidence-based librarianship by looking at our patron and community needs, and we're seeing in this emergency the need to be flexible and responsive. We have our own professional expertise and experience to inform our response efforts. We're looking to evidence and standards and applying and adapting guidelines to direct our responses, our searches, and our reporting. And echoing the opening again, we look to our communities of practice, such as Evidence for Global and Disaster Health, to share our expertise and experience and learn together. Next slide, please. The future of the Librarian Reserve Corps is at this time uncertain. We continue to revisit questions to guide our visioning for the Librarian Reserve Corps. We look at what the gaps in the evidence base for information response are and what research might be needed to support that. We try to consider the unique value of an agile corps of information professionals in an emergency and how that corps might be more responsive. And we look to other groups to see what they're doing in response to public health emergencies and disasters in terms of preparedness, response, and recovery. Next slide, please. And we wouldn't be here today without the guidance, hard work, and help of our founder, advisors, and volunteers. We thank them all for their hard work in guiding the LRC through to this point, 15 months later. It's amazing. And for their work on these projects, including the database validation study and best practices for search. Next slide, please. We'd also like to thank you today for staying with us. We know it's everyone's up at all hours around the globe. So thank you so much for staying with us. And with that, I'll turn it back to our host for today.
Thank you so much. Thank you, Stacy. Thank you, Robin. Thank you, Sarah. And thank you to all the Reserve Corps that are doing this amazing job. Wasn't that fantastic? And I have to admit, I didn't know as much as what you're doing. And I really enjoyed the presentation. So thank you. So we now have 15 minutes left for questions. And I can see there is some questions and answers on the screen. And I'm going to ask my colleague, Blessing Mawira, to deal with the questions and answers. So I will pass over to her to start asking some of the questions that have been given on the chat. Please remember that we have a space for few questions, and if you are unable to get your question answered during the live webinar, the responses will be posted afterwards on our page on the Evidence for Global and Disaster Health Special Interest Group webinar publications page that is on the slides. And I'm going to ask Emma to please post that in the chat again. So over to you, Blessing.
Thank you, Maria, and thank you to our panelists. The first question is on the COVID-19 specialist registers research. The question is, have you collected any data on the ease of downloading records from the COVID-19? Is RIS output possible for all?
Yeah, I can answer that. That's a good question. So for our study, we will be describing the retrieval features of the collection. So things like availability of truncation, Boolean operators limits, as well as the expert features. So I can't tell you off the top of my head. Some do allow export and some do not. It wasn't one of our main objectives of the study in terms of the search functions, but there will be some information on that within the study.
Thank you for that, Robin. The next question is, do you plan to remove preprints from the specialized database of COVID-19 publications if the publication has been published?
I think that's more of a question for the COVID databases. They would be able to answer that. And I know that there might be a couple who are at the webinar, so if they want to put an answer in the chat, perhaps they could do that. But yeah, it would be up to the individual databases to just determine what they do with the preprints.
Thank you. The next question is, what themes have emerged in the best practices meeting discussions held to date?
So far, we've had a few themes emerge in the best practices working group. So one of the key ones is transparency. So in emergencies, we need to respond quickly. We need to be flexible. We understand the urgency of the situation. And throughout all of that, we need to ensure that there's transparent and clear documentation. So it might not always meet the same level of reproducibility, but if we can provide transparent documentation, clear description of what we're doing and why we're doing it, it can help contextualize the results of the search and provide guidance to others in our communities of practice.
Thank you for that. We also have a question around languages. What languages were included in the study?
Oh, all languages. We didn't have any language exclusion. I mean, the majority of them are English, but we also did include any other languages are in there as well.
Great. And is there priority given for those with skills like previously serving in the military? Do you prioritize specific skills for people who want to volunteer?
Oh, sorry, repeat the question one more time.
The question is from Christine, says, is priority given for those with skills like previously serving in the military?
So the Librarian Reserve Corps is currently paused on recruiting new volunteers. We're working on wrapping up these current projects that we presented on today and kind of looking back at those questions on envisioning the future of the Librarian Reserve Corps. And as we envision the future of the Librarian Reserve Corps, we can better consider what skills would be important in prioritizing volunteers and projects moving forward.
Thank you, Stacey. We also have a question from Samuel, who says, could COVID-19 publications or databases from developing economies like the African Journals Online database, which has more articles from Africa, be included in this study?
That's a good question. Right now, we have we're pretty much finished our database evaluation, so we're really just verifying and validating our results. So we won't be adding any new ones. And I know that in the chat, people mentioned there's a couple of other ones that they use as well. But certainly, that's something that we might put in the discussion of just to let people know that that there are other ones available as well.
Okay. Thank you, Robin. I think the next one is also for you, Robin. For the COVID-19 collections, if the results for the collections are comparable to PubMed, why not just use PubMed?
Oh, well, that's a very good question. The difference is that everything in these databases, these COVID collections, is COVID-19 related, so the precision will be higher. PubMed does have all of these, but they have so much else as well. So for example, if you wanted to do a look at anxiety in school children due to COVID-19, you will definitely get results in both PubMed and any of these COVID-19 collections. But in PubMed, you will also have to add more search terms, and you still have to sift through other results on anxiety. PubMed does have more powerful search features, but it's still maybe more efficient to search a COVID-19 collection. And ideally, you would also want to use both because you do want to use more than one search for systematic reviews.
Thank you for that. I do know that Stacey partly answered this question. It was asked earlier on in terms of the COVID databases, if there's a guideline available for users about the strengths and limitations of each. And how can, if there is, how can others access it?
So the best practices for searching during public health emergencies, guidance document aims to be a bit broader than just specifically COVID-19. So it might not provide as detailed information as this participant might be requesting. We're definitely informed by our experiences responding to COVID-19, but we're trying to think ahead and think more broadly on what is the general guidance, best practices, and recommendations for responding to an emergency, no matter kind of the type, and moving forward based on some of the themes that we're seeing in COVID-19. It might be that some of the results of the database validation study might be helpful to this participant. So looking at what is most current and complete, so depending on the needs of their communities, and including in that discussion of the database validation study, some of the key features or what might be missing from these different databases. But I'm happy to take a closer look at the question as well.
Thank you very much for that. We also have a question that says, what measures have you put in place or done to check biases in the study?
Oh, okay. Well, this is an independent study. So while we have had discussion, had Stacey and Sarah have discussion with the database producers, the study is separate from them. We're not doing it with them. It's a study for others. In terms of the measures and biases, we are verifying and validating all of the results that we've gotten from the searchers. If you want more information, it would be in our protocol as well.
Great.
I just wanted to mention too, because I think Anna's had her hand up for a little bit.
Okay, sorry, I didn't see that. And you can go ahead.
It's okay. I just wanted to say, in following on from the question about other languages, that we were incredibly excited the first time we sat down and talked to Sarah and Stacey and Robin, not only because of the excellence of their work, which is just fantastic, and to do all this in such a robust way at a time when everybody's really pressured was fantastic. But we felt that there was something that we could do alongside them, if you like, in helping use the networks that we've got access to through IFLA to help expand the range of people that could come in and help with thinking about how these things play out across other places and other regions. So we just had members joining the group from the Lebanon, Ola, who's on the call. We've had discussions with librarians in Malaysia. Obviously, Blessing is very active in engaging with other librarians in Africa. And so we hope that if we can do anything to support the work by sort of making more of those contacts and getting different views and different considerations about the issues of how evidence fits in different cultures and different places, that would be fantastic. So just thank you again for the presentation to the team. It's just brilliant.
Thank you, Anne. Our last question, maybe to Stacey or Sarah, is how would the results of these projects be disseminated? I do know that in your presentation, you mentioned a few. I don't know if you want to elaborate on this.
Yeah, so I can answer that, and Sarah, please let me know if I've missed anything. So you can keep an eye on Librarian Reserve Corps on Twitter. We do have an active committee on public relations to get the word out when we do post results on these. We're hoping to submit abstracts to conferences throughout the next year, so conferences for librarians and information professionals, as well as evidence synthesis researchers. So hopefully we'll see you at a conference. We will post these as preprints and or on the OSF server. So the database validation study protocol is there, and we're going to work on moving over some of our documentation for the best practices project onto an OSF project. We will post what we can and what we have on our Librarian Reserve Corps website, and we're going to reach out to journal editors about options for publication moving forward once we have a more complete product. So hopefully that's a few different channels, and we'll run into you on one of them, and we'll share the links that have content live now with E4GDH to post them on the page for this event.
Fantastic. Thank you very much to our panelists for answering the questions. I'll hand over back to Maria.
Thank you, everybody. We are almost at the end of our webinar, so all that is left for me to do is to thank everybody. To thank, first of all of you who have attended for giving us your time and for your questions. To remind you that the presentation slides are already available on our page, and you can find the link to that on the chat, and it's also on the slides that are also already available there. That we're going to put the recording up in a few days, so give us 3 or 4 days, and after the weekend we will do that, and that will be accompanied by a list of resources that Stacey, Sarah, and Robin will put together, and there will be any answers to any questions that we haven't had time to do for today. I also wish to thank the speakers, starting with Sarah, Robin, and Stacey again, for not only for their time today, but also for all the work they are doing. And I also would love to say thank you to Anne Bryce, our convener, because none of this will be disseminated or happened without her leadership. So thank you, everybody. We have more webinars coming up, so please keep joining us. Please keep an eye on our activities. We also have a very exciting and provocative, I would say, as a clue session that we are being prepared for the World Library Information Congress in August, and we will love to see you there. And we thank you for your attention. Have a fantastic rest of the day. Bye-bye, everybody.